but not have us competing.
For Global Medical News Network, this is Miriam Tucker reporting from the 5th Decennial International Conference on Healthcare-Associated Infections 2010 in Atlanta, Georgia. I'm with Dr. Robin Livingston, Director of Infection Control and Prevention at Children's Mercy Hospital in Kansas City. Dr. Livingston, you reported that employee influenza immunization rates at your hospital have increased dramatically over the last 5 years. How did that come about?
Well, I'll tell you, back in 2004, our employee vaccination rate was around 63% overall. And we've employed various vaccine strategies through the years to try and increase that rate. We offered free flu vaccine back in the beginning in education, and then through the years we have what we call a mass vaccination day, and we have vaccine mobilization carts. Back in 2007, we actually created a declination policy where you either had to get vaccine or sign a declination form. Back then it was mandatory. Last year we decided that you needed to either be vaccinated or sign a declination form, either or, but you had to be compliant by the deadline, and if not, you were ineligible to work until you became compliant with our policy.
And what was your rate in 2009? Actually,
we were able to increase our rates from 63% back in 2004 all the way to approximately 91% last fall, with 98% of our employees compliant with our policy.
Great. And what are your plans going forward?
Well, we realized that even though our vaccination rates are higher than the national average, which is typically around 40 to 45%, we still have a lot more work to do, and our rates could be higher. So we are considering making influenza vaccination mandatory for all employees next fall.
Thank you so much, Dr. Livingston. For Global Medical News Network, this is Miriam Tucker reporting.